Now, Ghana continues to record high glaucoma cases, second to Nigeria in Africa, with almost 8 of every 100 Ghanaians aged 30 and above, and 9 of every 100 Ghanaians aged 40 and above living with glaucoma, according to a report published by Health Journal, African Vision and Eye Health. Statistics also reveal that 1 in every 5 persons in the country is blind from glaucoma, highlighting the urgency of the situation. There's more in the following report filed by Citi News' Yawo Denya and read by Ajwa Tinkrama Domina.
Glaucoma is a group of eye diseases that are characterized by loss of vision due to the damage of the optic nerve. The symptoms can start slowly and might be difficult to notice. According to data, glaucoma remains one of the primary causes of blindness in Ghana, with over 700,000 Ghanaians living with glaucoma and 45,000 people blind due to the disease, making it one of the leading causes of blindness in the country. These statistics underscore the urgent need to address the eye care needs of Ghana's growing population. Citi News has been speaking with some glaucoma patients about what it means to be living with glaucoma.
It's not been easy, because the day in, day out, your vision becomes blurred, and your vision starts getting closer. It gets closer, and it's difficult seeing your sight and sight. And even now, as we speak, even the night driving becomes difficult because your sight visions are beginning to be blurred. The treatment of glaucoma, as we are all being told, that it's a lifetime treatment, and it's all by drugs. And they sometimes have tried to advise you to use surgery, but to those who have done surgery, I have not really seen any results, meaningful or positive results from them.
The first diagnosis I got was somewhere in 2015 because I had visited the hospital because my eyelids were swollen. Yes, I remember correctly. My eyelids were swollen because I had used a mascara or something of that sort. So I went to the hospital to get something to soothe that pain. So they told me that I had to do some follow-up tests because the pressure in my eye was so high or something of that sort. I said, okay. I did a test and I did follow-up test. Later on, they said I had glaucoma. So I think I was given some drops, some eye drops to use to kind of control the pressure.
I discovered I had developed glaucoma somewhere in 2017. I was diagnosed, and then the doctor said it was at the advanced stage. So I could manage it at the time either by surgery or by drops. I opted for drops, which is what I've been using till now. Managing the environment. So the biggest challenge is how you maneuver your way through your spaces. You have to learn your spaces very quickly to be able to have a decent approach to moving around.
Meanwhile, the Vice President of the Ghana Optometric Association, Dr. Alfred Gademo, has been sharing with Citi News the factors influencing the rise in the number of glaucoma cases in Ghana. He adds that there is a need for government intervention in subsidizing the cost of glaucoma treatment to curtail its impact.
Most often, if you have glaucoma, you may not know, as your peripheral vision is what gets lost with time, gradually narrowing into the center. So sometimes we say those with glaucoma often suffer what we call tunnel vision, in the sense that they only have vision in a small area of the visual field. Glaucoma is rising in Ghana not because there's something particular people are doing, but mainly because now we are able to detect glaucoma more easily. So it seems more people are turning out as having glaucoma. Clinicians have gotten better at detecting glaucoma. The equipment and the technology available have become more advanced, so it's very easily detectable now. So there are some challenges with managing glaucoma in Ghana. One of them is that some hospital facilities still do not have the full range of equipment to effectively detect and manage this condition. some of the hospitals are not well equipped to actually handle glaucoma effectively. Another reason is that the medication used to manage glaucoma is not readily available, and even if it's readily available, it's quite expensive and out of the reach of the average Ghanaian. What would be required would be to have, if possible, subsidized cost of medication in managing glaucoma. This is something that government can help us with in terms of equipment and affordable medication.